So how do we take care of hernias? Well, if a hernia needs to be repaired, then it should be repaired. If a hernia is not causing symptoms, or if the hernia occurs in a person who is too ill to undergo an operation, then the hernia can be managed using a specialized hernia belt. The hernia belt would wrap around the person and push the area of the hernia in such that the hernia is pushed in and causing fewer symptoms. Unfortunately, hernia belts need to be worn permanently. They're uncomfortable. They won't solve the problem. They will just temporarily treat the problem. If a hernia needs to be repaired, and really any symptomatic hernia in somebody able to undergo surgery should be repaired, then the hernia repair usually requires an operation. These operations almost always require that anesthesiologist be present to sedate the patient or even put them to sleep. If the hernia is small enough, for instance, a belly button hernia less than about a ½ an inch, they can be repaired in the operating room with a few stitches. Hernias that are larger in the belly button or in a prior surgical incision or in the groins usually requires repair with some form of surgical mesh. The repair is done in general using laparoscopy or robotic surgery with tiny incisions, unless it's a very small belly button hernia, in which case it can be repaired with a little incision that can be hidden in the belly button and sutures to close the muscle lining. The question is mesh safe? If you go online, you're going to see lots of reports of attorneys who are looking for patients on whose behalf they can sue because of the use of mesh at the time of the hernia repair. The bottom line is that hernia repairs with mesh are some of the most common operations done in the United States. And if the hernia repair is done properly, using the correct type of mesh, the likelihood of problems from the hernia repair is exceedingly low.